The center clinic came about, it kind of was a rebirth. Dr. Bernard and I had run a similar clinic through the local public health agency for about 7 years, I believe. And they had lost their funding after I left my position there. We knew the needs that existed in the community, not only in our underserved, underinsured population, but also in our teen population. And Matt and I both felt strongly that there was a great need for the services in our community.
The Center Clinic is a non-profit clinic based on volunteers, began operated in 2004. The majority of the populations that we see here are Hispanic, and they are seeking for family planning, and also come from non-family planning for like a chronic diseases, hypertension, diabetes, cardiac problems. So they come to see for that because they don't have anywhere to go.
So our teens mainly are young and healthy. They come in for their birth control, their STD testing. And then our primary care patients come in for a plethora of different conditions. And a lot of our care, again, the holistic model kind of wraps in all of the really unique needs of the patient.
Besides the primary care and family planning services that we do a lot of education. We talk about violence, domestic violence, sexual abuse. Also, we talk about how to manage depression and anxiety, and they are aware of that and they help themselves about that or help somebody else if they can recognize symptoms of depression or anxiety.
One of the most impressive partnerships that we have had throughout the years that we've operated the center clinic has been our partnership with Cass and Mayo Family Practice Residency program. As a volunteer-based clinic, if we had to pay our providers, it would be very difficult to provide these services. So that partnership with Cass and Mayo and the residency program has been an amazing partnership, and we have literally served thousands and thousands of individuals that would have gone without health care.
It is important, in my point of view, the residents have this experience exposed to this community because these populations are very poor, low income, with language barriers. And when the residents come over here, they are learning how to bear these barriers.
I think community engagement, especially for family medicine, is important because we are the first people patients will kind of encounter within the healthcare system. Once about a month, we get to volunteer there in the evenings, and that's been a very good opportunity to kind of work with interpreters and also kind of learn about working in a low resource setting.
Some of the residents get really invested in the clinic during their time here, and they take a little piece of our heart with them when they go. They really do make an imprint on our patients and on our community, and even though they might not physically be here with us any longer, the work that they do kind of lives on through the patients that they see.